Okay, this is going to go over the exam 3 exemplars for pharmacology. The first drugs we're going to go over are the antianginals. The first drug that we have is nitrates, and the drug is nitroglycerin. So the action of nitro is to promote vasodilation, and it increases blood flow through coronary arteries to myocardial cells, which are your heart muscle cells. Side effects of nitro is going to be headaches because it's a dilator, so not a lot of blood is going to go to your brain. It could also cause hypotension, flushing, which is just face blotchiness due to vasodilation, dizziness and weakness, and syncope, which is a loss of consciousness. The route for this drug is going to be sublingual, so you give one tablet every 5 minutes, which you could give a max of this 3 times. So if pain persists after the third one, you want to usually go to the ER or call a provider. Only give more than one tablet if the patient is still having pain after the previous dose. Pretty self-explanatory. Other notes of this drug is you don't want to touch the pill with your bare hand because it could cause hypotension. The pills are typically in the brown bottle that they're in because they are sensitive to sunlight. Erectile dysfunction medications are a contraindication because they also vasodilate, so having 2 drugs that would vasodilate is bad. This drug takes about 3 to 4 minutes to cause an effect. Don't take alcohol on this drug. Notify the provider if chest pain is still persistent after 3 tablets within 15 minutes. And you usually want to administer with this drug if the patient is sitting or laying down. Next is your beta blockers, and the drug is atenolol. So the action of this drug is to block beta 1, which is like your heart, and beta 2, which are your lung receptors. So beta 1 controls your heart rate and contractibility. So if beta 1 was blocked, it would decrease heart rate and decrease blood pressure. For beta 2 is your bronchodilation center. So blocking this will cause bronchoconstriction. So since we are blocking beta 1, we're decreasing heart rate and blood pressure. Blocking beta 2, we might have some kind of bronchoconstriction, but I'll explain that at the end. More on this, it blocks action of catecholamines, so you're going to block the epinephrine and norepinephrine, and you're also going to reduce workload of the heart and O2 demand. Side effects of atenolol is bradycardia, hypotension, and dizziness. This is usually just because of the beta 1 effect that it causes. It could also cause depression, fatigue, and erectile dysfunction, as well as peripheral edema and bronchospasms. Pretty serious side effects. A lot of people don't like taking this drug because of the depression and fatigue that it could cause. Cautions for this drug is you want to slowly taper off the drug to avoid reflex tachycardia, which is a rapid abnormally high heart rate to substitute for a low blood pressure that it causes. This is so like slowly getting off the drug avoids reflex tachycardia. Another note of this drug is atenolol is a beta 1 selective drug. So under normal doses, it will have very minimal beta 2 effects. So you won't really see much of that bronchoconstriction. But in high dosages, it could cause bronchoconstriction. And this is where you see the side effects like edema and bronchospasms. Lastly is your calcium channel blocker. This is diltiazem hydrochloride. The action of DIL is it blocks calcium from entering the heart muscle cells. Calcium equals contraction, so it causes a relaxation effect. So basically your heart is not working as fast or working as hard. The drug relaxes coronary artery spasms and peripheral arterioles. It decreases contractibility, afterload, and resistance. It also reduces cardiac workload and oxygen demands. It causes mild vasodilation and moderate arterial dilation. This is kind of where the side effects come in with the arterial dilation. So you have dizziness, flushing, and headache. This is just common. Hypotension as well. And then peripheral edema. This is mainly because of the arterial dilation. And last thing is don't discontinue without talking to a provider. Very similar to a atenolol, where you most likely have to taper off the drug, where you should contact the provider for DIL and atenolol. All right, and here are the antihyperlipidemics. First one we'll go over is fibrates, and the drug's name is gemfibrozil. The action of this is to reduce VLDL, LDL, as well as triglycerides. Side effects you'll see is dizziness, blurred vision, fatigue, nausea, vomiting, dyspepsia, and abdominal pain. They're kind of like the same thing. They kind of cholestasis is gallbladder stones, and constipation and diarrhea. Other notes of this drug is you don't want to take this drug with anticoagulants just because they're both gemfibrozil and anticoagulants usually are highly protein bound and could cause problems with that. And usually you want to give this drug before eating about twice a day. Next drug is niacin. Niacin is a type of vitamin. The action is to reduce VLDL and as well as LDL, very similar to gemfibrozil. Side effects are going to be GI disturbances, flushing, abnormal liver tests. So just to go over, your liver tests are going to be AST, ALT, and ALK Phos. Could also cause hyperglycemia, hyperuricemia, which is high uric acid in the blood. Other notes for this drug is that large dosages are needed and could cause a lot of side effects. So typically only 20% of patients could tolerate this drug. To increase tolerance to about 60 to 70%, you could take the drug with aspirin to lower side effects. You have to titrate this drug up just because of, the dosages you have to give for it, and you can't give such a high dose instantly. You need to titrate it. And you usually want to give this drug after eating about once a day. Next are going to be the statins, and the drug is atorvastatin. Statins are the best for cholesterol. So the main action of these are going to be to decrease cholesterol, decrease LDL, which usually takes about 2 weeks, decrease VLDL, decrease triglycerides, as well as slightly increasing HDL. Side effects of this is going to be increased liver enzymes, just like niacin. And then the two main things for this drug is it could cause myalgias and rhabdomyolysis, which myalgias is muscle pain and rhabdo is muscle breakdown. So if you were to see any of these side effects with a patient, it's very important to get them off the medicine immediately. Other notes with this drug is you don't take grapefruit juice with this drug because statin and grapefruit juice bind to the same CYP 450, I believe, in the liver. So statin won't break down if you take grapefruit juice. You want to monitor liver enzymes every 6 to 8 weeks when on this drug, as well as have annual eye exams because there's a risk of cataracts. Statin is a lifetime commitment drug, so you only really stop the drug that we have to know is if the patient has muscle pain, muscle aches, anything like that. Next is going to be cholesterol absorption inhibitors, and we have ezetimibe. The action of this drug is it acts on the small intestine cells to inhibit cholesterol absorption. So you're going to decrease cholesterol from your diet as well as decreasing LDL, cholesterol, and aptob levels. And aptob is a protein that transports cholesterol. As well, it also slightly increases HDL. Side effects of this drug is going to be diarrhea, abdominal pain, back pain, and fatigue. Could cause infection as well as arthralgia, which is joint pain, as well as myalgia, which is muscle aches. And it could also cause cholestasis, which is gallbladder stones. This drug could also increase liver enzymes. Most important thing for ezetimibe is that you must take it with a statin, which usually means that statin didn't work as well for the patient. So the patient might be maybe placed on ezetimibe to kind of boost the effects of statin. Very similarly, we have the bile acid sequences, and cholesterol is the drug. The action is it is the first anti-hyperlipidemic to decrease LDL. Side effects of this is going to be constipation, peptic ulcers, GI problems, so nausea, vomiting, diarrhea, and steatorrhea, which is greasy, fatty stool. This is because you're not absorbing fats as well. Um, and just some other notes. This is another drug that you must take with a statin. So a statin again is not working well with the patient. You're probably going to take cholesterol or ezetimibe. And lastly, you want to mix this drug with about 60 to 100 milliliters of water to take it. Alright, and here are diuretics. So the first one that we have is a thiazine, and the drug Exemplar is hydrochlorothiazine, also known as HCTZ for an abbreviation. The action is that it promotes sodium, chloride, and water excretion in the distal convoluted tubule. The use is mainly for hypertension and edema. Side effects for this drug is going to be electrolyte imbalances, which include hypokalemia, hypomagnesium, hypercalcemia, hyperglycemia, hyperuricemia, and hypercholesterolemia, and then it could also cause hypotension. Contraindications for this are going to be renal failure. Drug interactions are going to be digoxin, which can cause a decrease of potassium, and lithium, which is where HCTZ hydrochlorothiazine could cause an increase of lithium action. Other notes for this drug is you want to take this drug with food to avoid GI upset. Eat food high in potassium while on this drug because it could cause that hypokalemia. Use sunblock because of risk of photosensitivity. Take this drug mainly in the morning, and this drug can be used alone for recently diagnosed mild hypertension, but it could also be combined with ACE, ARB, beta blockers, or potassium sparing drugs. Next we have is the loop diuretic, and the drug is furosemide. The action of this drug is to inhibit sodium transport and reabsorption. Side effects for this drug is going to be orthostatic hypotension, ototoxicity, which is very important for furosemide, where you want to administer the drug slowly. Hearing loss could occur with administering furosemide fast. And then you could also have the fluid and electrolyte imbalance. So it's a little different from HCTZ, but this one could cause hypokalemia, hyponatremia, which is low sodium, hypocalcemia, hypomagnesemia, hyperglycemia, and hyperuricemia. Other notes with this drug is that digoxin is a drug interaction, which is the same thing, which could cause a It could cause a decrease in potassium. This drug is very protein bound, so taking it with anticoagulants could be a bad idea. And then you want to change position slowly while on this drug, mainly because of the orthostatic hypotension. Next is the osmotic diuretics, and we have mannitol. The action of mannitol is to increase osmolarity and sodium reabsorption in the proximal tubule and the loop of Henle. This is a very potent drug, and it's mainly used in emergency situations, so you're really going to use this for decreasing intracranial pressure, which could also be cerebral edema, and decreasing intraocular pressure, such as glaucoma. Side effects for this drug is going to be pulmonary embolism, tachycardia from the rapid fluid loss, and nausea, vomiting. Contraindications are going to be heart disease and heart failure, or heart disease or heart failure. Other notes with this drug is that I said this, but it's very potent, used in emergency situations. Next is the carbonic anhydrase inhibitors, and this is acetazolamide. acetazolamide. The action is to block carbonic anhydrase, which originally maintains the acid-base balance in the body. So with this, you're going to be increasing the sodium and potassium and the bicarbonate excretion. Use of this drug is to decrease intraocular pressure in patients with chronic glaucoma. Side effects are going to be nausea, vomiting, anorexia, confusion, and orthostatic hypotension. Contraindications are going to be hypokalemia, hyponatremia, which again is a low sodium, metabolic acidosis, which is where your body is too acidic, and renal and hepatic disease. Next is a potassium sparing diuretic, and the drug is spironolactone. The action is to block aldosterone, which aldosterone controls the sodium potassium pump, controls sodium retention and calcium excretion. So since aldosterone is blocked, you're going to have a decrease in sodium, decrease in water, and an increase in potassium. So this drug is a potassium sparing diuretic, so it keeps the potassium, unlike every other diuretic that we went over, removes potassium. Side effects are going to be hyperkalemia, gynecomastia, which is man boobs, orthostatic hypotension, erectile dysfunction, and parathesia, which is like when you're not moving and your leg falls asleep. That's what that is. Other notes of this drug is you could have life-threatening hyperkalemia when given with an ACE inhibitor or an ARB. Now we have the antihypertensives. The first antihypertensive is the ACE inhibitors, angiotensin converting enzyme inhibitors, lisinopril. So the action of lisinopril is to inhibit the angiotensin 2 enzyme that makes angiotensin 2, so then you won't have this severe vasoconstriction. You also do have the effect of blocking aldosterone with this drug, which decreases sodium and increases potassium, kind of like spironolactone. Side effects, biggest side effect is a dry cough, insomnia, hyperkalemia because of the blocking of aldosterone, tachycardia, and angioedema. Contraindications for this drug is spironolactone because they both have aldosterone blocking effects, pregnancy, and salt substitutes that contain potassium because most salt substitutes are something with potassium. As far as ancestry, African American ancestries usually don't respond well to these ACE inhibitors, but they do respond well with diuretics. So like hydrochlorothiazine you could give as a diuretic if the patient's not responding well to the ACE inhibitor. So you could either combine it with the ACE inhibitor or just give it completely separate. Next is the angiotensin 2 receptor blockers, which are your ARBs. The drug is valsartan. The action is to block angiotensin 2 from binding to its receptors. Side effects are going to be edema, nasal congestion, drowsiness, and palpitations. Adverse effects are going to be hyperkalemia. Again, this is why you don't give it with spironolactone. Rhabdomyolysis, which is muscle breakdown, and increased liver enzymes. Contraindications are going to be pregnancy, and you're going to have a less likelihood to produce an irritating cough, just like in lisinopril, how you do have a cough. Valsartan, you probably won't. The next drug is a beta blocker, metoprolol, extremely similar to the beta blocker Adenol that we went over with Antianginals. So I won't spend too long on it because, again, the side effects and the actions are pretty much the same. The action is to inhibit beta 1. It's more of a selective drug than a non-selective, so you're really only going to get the heart effects. Side effects are going to be hypotension, bradycardia, insomnia, depression, nightmares, and erectile dysfunction. On top of that, with ancestry, typically African American patients don't respond well to beta blockers alone to control their hypertension. And you usually want to talk to a provider to get off the drug because you have to taper the drug to avoid rebound hypertension. That's pretty much it. Next, we have is a calcium channel blocker, amlodipine. Again, very similar to the calcium channel blocker, diltiazem hydrochloride. So, pretty much the same thing here. So, the action is to decrease calcium so that heart muscle contractibility decreases. Side effects are going to be bradycardia, chest pain, tachycardia, typically because your blood pressure could drop so low with this drug that you're going to have some tachycardic effects. Palpitations, dyspnea, and hyperglycemia, and then an adverse reaction is going to be angioedema. Lastly, we have the direct acting arterial vasodilators, and the drug is hydralazine. The action of hydralazine is to relax smooth muscles of the blood vessels, mainly in arteries, causing vasodilation. The use of this drug is going to be for hypertension or hypertensive emergencies. Side effects are going to be headache, dizziness, tachycardia, hypotension, and you could usually give a beta blocker for the tachycardic effects, palpitations, and lupus. Okay, next we have the complementary and alternative therapies. The first one is ginseng. The use is for stress and concentration, and then it also boosts the immune system and can prevent infections. Side effects are going to be insomnia and hypoglycemia. And then it also has drug interactions with statins and anticoagulants, so probably just staying off of those would be best for taking ginseng. Next is chamomile. The use is for anxiety relief, and then it also has sedative effects, so you could take this in a tea before bed for better sleep. Side effects are going to be nausea and dizziness, and allergic reactions could occur with this, where you could have urticaria or bronchospasms if you're allergic to ragweed. Next is echinacea. The use is for colds, flu, and infections, and it also stimulates the immune system. Side effects are going to be nausea and stomach aches. Garlic use is for hypercholesterolemia, which is high cholesterol in the blood, hypertension, and it could also reduce heart disease. Side effects are going to be body odor and a decrease in clotting. Ginger is for nausea, motion sickness, and swelling, mostly for the nausea and motion sickness. Side effects are going to be gas and bloating. Lastly is St. John's wort. Use is going to be depression, ADHD, and OCD, and it could also be used as a topical use for wounds, bruises, and muscle pains. Side effects are going to be dry mouth, GI problems, sexual dysfunction, and photosensitivity. It also has drug interactions. One of the biggest things it could cause serotonin syndrome, which is an increased level of serotonin, and this could cause agitation and confusion, seizures. This is usually caused by antidepressants while taking St. John's wort. And then anticoagulants and anti-seizures also have an interaction with St. John's. Next is going to be the vitamins and minerals chapter, specifically the fat-soluble vitamins. So these are going to be your adduct vitamins. Vitamin A, used for bone growth, as well as hair, skin, and eye maintenance. Hypervitaminosis, which is a very high level of this vitamin, is you're going to get teratogenic fetus effects, hair loss, and nausea, vomiting. Hypovitaminosis, which is a low amount of vitamin, is going to be night blindness and blindness in general. Foods with vitamin A is going to be carrots, mangoes, fish, and dairy. Vitamin D use is to regulate calcium metabolism as well as assisting in calcium absorption. Some components of vitamin D is vitamin D2, which is ergocalciferol, which is a plant-based, where it comes from food and other products like cereal and soy. And vitamin D3 is cholecalciferol, which is made in the skin due to or by sunlight exposure. We also have calcitriol, which is an active form of vitamin D. Hypervitaminosis of the drug is going to be hypercalcemia as well as anorexia and nausea and vomiting. Foods are, I might have said drug, but it's a vitamin. Foods are going to be milk, eggs, cereal, fatty fish, and liver. And another fact with vitamin D is that it takes about 10 to 15 minutes after sunlight exposure until your body starts to make vitamin D. Vitamin E, used as an antioxidant, so it protects our cells from damage by free oxygen radicals, which prevents hemolysis. Side effects are going to be bleeding, GI upset, and fatigue. Other things with this vitamin is it causes a prolonged PT time where it takes longer to clot, and you don't want to give vitamin E with iron because iron could interfere with vitamin E absorption. Foods are going to be nuts, seeds, fruits, and vegetables. Vitamin K is used for synthesis of prothrombin and clotting factors 7, 9, and 10, and it also prevents hemorrhaging. Something else with vitamin K is that half of our body's vitamin K is actually made in our intestines by bacteria. Vitamin K is also linked with warfarin because warfarin blocks vitamin K, so if that helps you remember it. So that was our fat-soluble vitamins. Now these are our water-soluble vitamins. Vitamin B complex. There's 4 different complexes inside of vitamin B. So first is B1 thiamine. Deficiency could cause polyneuritis, which is nerve inflammation, and Wernicke encephalopathy, which is a neurological disorder. B2 riboflavin is associated with dermatologic problems like cracked lips as well as migraines. B3 is niacin. This is related to pellagra, which is dermatitis, diarrhea, and dementia. And then it's also linked to hyperlipidemia. B6 is pyridoxine, and it's involved in preventing neuritis, which is inflamed nerves, especially from INH use. And it also acts on building blocks for nucleic acid in red blood cell formation. Next is vitamin C. The action is it assists in collagen formation, wound healing, immune function, as well as iron absorption. Foods you could find this in is citrus fruits, cantaloupe, tomatoes, and leafy green vegetables. Folic acid, it's good for body growth and DNA synthesis. And typically, because it has this DNA synthesis effect, you typically want to start at the very beginning of pregnancy to help a fetus. Deficiencies can include CNS defects of a fetus, so like spina bifida, neurotube defects, as well as nausea, vomiting, diarrhea, and fatigue. Foods are going to be bananas, carrots, leafy greens. Vitamin B12, it's used for DNA synthesis, folic acid conversion, hematopoiesis, which is blood cell formation, as well as maintaining the nervous system, especially in the myelin. Deficiency risk is pernicious anemia, which is people who don't have parietal cells to make intrinsic factor. What this means is that they have an inability to absorb vitamin B12, and then vegetarians also have a risk just because they're not going to have the foods like fish, eggs, and salmon, which are big for vitamin B12. Still in the vitamins and minerals chapter, here are the minerals. Iron, good for hemoglobin formation and regeneration as well. Lots of this is needed for pregnancies to help give hemoglobin and blood to the fetus. Deficiencies include fatigue, weakness, and shortness of breath. Toxicity includes hemorrhaging. Taking this with food is good to avoid GI upset. Copper. The action is it helps form red blood cells and connective tissue, and it also produces neurotransmitters. So these are going to be your norepinephrine and dopamine. A deficiency in this would cause anemia, blood changes, and mental retardation. Toxicity would cause Wilson's disease. Zinc, good for growth, appetite, wound healing, and mental activity. Deficiency occurrence could be due to alcoholism, pregnancy, or even refined cereal. And then excess zinc could cause a copper deficiency, a decrease in HDL, and a weakened immune system. Chromium acts on carbohydrates, lipid, and nucleic acid metabolism. Deficiency of this would include hypoglycemia, dizziness, sleepiness, and excessive thirst. Toxicity would include GI bleed and seizures. Selenium has a role in reproduction as well as thyroid hormone metabolism and DNA synthesis, and it's also an antioxidant. Deficiencies would include hypothyroidism and muscle weakness and pain. Excess selenium would cause hair loss, nausea, vomiting, diarrhea, and sometimes a garlic skin odor and breath. Lastly is the marijuanas. First is medical marijuana, where it's good for a couple different things like cancer, nausea, pain, seizures, and PTSD. A couple other things like muscle spasms, but it's a long list. Side effects could include an increased heart rate, sleepiness, appetite, or an increased appetite, uh, a decrease in blood pressure and urination, worsen of asthma and COPD, and cardiac disease. There's also withdrawal with medical marijuana, where it could cause insomnia, loss of appetite, and anger. Just to talk on administration of medical marijuana, usually nurses can't give medical marijuana unless it's FDA approved, and you have to be a registered MMP or MMP, a registered MMP caregiver. Lastly is recreational marijuana. It's used for depression, isolation, anxiety, insomnia, PTSD, and pain. Risks of taking this include pulmonary risks, motor vehicle accidents, mental health, cancer, and cannabinoid hyperemesis syndrome. This is cannabis hyperemesis syndrome is due to regular cannabis use, could cause nausea, vomiting, and abdominal pain. Some people get relief from taking hot baths or hot showers, but most of the time these symptoms will resolve when you stop taking cannabis. And this usually occurs in younger males. And that is all for the exam 3 exemplars.